Today we're going to be demonstrating how to do canine male urinary catheterization with the butterfly method. Before we get started, we want to make sure that we're prepared and we have all the supplies that we need. We have our lab requisition form. We should also have our patient file. We have 2 syringes. So I have a 5 ml syringe here, which will be used for the discard urine. And then I have a 12 ml syringe to collect the sample. We also have a package of sterile lube, a sterile red top tube, and the urinary catheter itself. We have a pee pad to put underneath our patient to collect any urine that may drop from the catheter, scissors to work on the catheter package itself, clippers if needed, and Hibitane soap for the penis. Have my patient in lateral recumbency. I would have somebody restraining my patient. This is not a live patient, that is not an issue. Looks like our patient does have some longer fur. So I will take my clippers and just gently trim the ends of the fur on the penis. We don't want to clip the fur all the way down to the skin on the penis. At prepuces, that will be irritating and we don't want to cause any cuts or damage to that. I'm going to move my Hibitane soap here so it's ready to go. My syringes. Okay, so now what I'm going to do is I'm going to demonstrate the butterfly method. So with this method, I do not need to have sterile gloves on. What I'm going to do is I'm going to cut a tab in the area near the end of the working end or the tip of the catheter. The best way to do this is to slide the catheter to one edge, make 2 slits, and it's best to make a wider butterfly because especially when you're first learning, you want to have enough working area for your fingers to move without contaminating the catheter. Now to do the other side, I'm going to slide the catheter to the opposite side and I'm going to make the cuts along there. Now, what I will do is I will open my sterile lube. I'm going to hold on to this end of the catheter and the butterfly tab that I've created. I'm going to pull the end piece off and put it off to the side, keeping that end sterile. And what I'm going to do is if you gently open the catheter, you can drop some sterile lube into the package as well as onto the catheter. So I'm going to put some, not touching the catheter with the lubricant package. I'm just dropping it onto the catheter itself, and any leftovers will catch in my butterfly. I will now take the end of my package and very carefully insert it back over so the tip of my catheter is covered. I don't want to put it right at the front end of my patient because if this was a live patient, their head could knock it or contaminate it. So I'm just going to put it off to the side where I know that it's safe. And now what I'm going to do, you can see that I have pre-opened these syringes, so they are ready and available to grab once I have the catheter in place. I'm going to now extrude the penis. So I'm going to gently grasp the Oz penis and I'm going to push it cranially. I'm going to gently grasp the prepuce, and I'm going to gently pull that caudally, which will extrude the penis. I'm going to take a Hibitane scrub and I'm going to gently clean any discharge from the penis. And I will now grab my catheter. I'm going to hold on to the butterfly tab that I've created. Use my other fingers to remove the end. And you can see here that the catheter is still sterile and has the lubricant on it. I am going to gently insert it into the urethral opening. As I'm inserting, I'm using this butterfly to grasp the catheter, so that way it is always remaining sterile. I'm going to gently advance the catheter. Now remember, I have pre-measured, as we did in the earlier video, to know how far to advance my catheter. You may feel a little bit of resistance when you are advancing the catheter through the pelvic canal. When this happens, you want to just use gentle but firm pressure to help get it past the pelvic canal. All right. Once I am to the place where I've pre-measured for my patient, I can let go of the penis. I can take this end off, the bottom end off of my catheter. If you leave the butterfly in place, that is nice because you can then advance the catheter further if you need to. I'm going to hold the end of my catheter. I'm going to take my 5 ml syringe. Now, if this was a live patient, if I was in the bladder, I'd most likely see urine dripping from the catheter, but not always. I'm going to sterilely put the end of my syringe into my catheter. I'm going to remove the first 5 or 6 mils, which is my discard urine. And now I'm going to take my syringe for my urine sample. Okay, and now I can take that off, put it back in the sterile container or packaging, and now I can fold the catheter back on itself and gently remove the catheter. You can always take a piece of gauze and gently wrap it around the tip of the penis to prevent any urine from splashing at you or your restrainer. Put this aside for garbage. I'm going to ensure that the penis goes back in and is encapsulated by the prepuce. I will now take my sterile red top tube. I will remove the top, keeping everything sterile. I will take my sample, place it into the red top tube, replace the cap, and I will label my red top tube with the patient's full name, the date that it was collected, the entire signalment of the patient, and the time that it was collected. From there, I will go to my rec form and I will make sure that we complete all the proper patient information, the tests that need to be run. We need to also write down the method that the urine was collected, so check off via catheter, as this will affect the pathologist's way of interpreting the sample, and also the time that it was collected. From here, we will put all the requisition form and the red top tube in a Ziploc bag and place it in the fridge until it is ready for pickup.